Hello, it's Dr. Edward. I'm back again doing today's live stream for the second time due to a tech failure. So today on my regular Holistic Pet Health show, I want to talk about the whole philosophy and concept of holistic pet healthcare. Holistic healthcare is something that is going gangbusters, growing like you wouldn't believe all over the world. There's a lot of people becoming more and more interested in holistic, natural ways to support health and well-being for themselves. And of course, many of these people are now super keen to apply the same principles for their animals. So I find that a lot of people that are into holistic pet healthcare are kind of fanatical about it. And I've been guilty of this myself. I'm on a prescription medicine called low-dose naltrexone to help me with symptoms from chronic fatigue and stuff like that. It's helped me heaps. But a few years ago when another doctor offered it to me, I was in my fanatical stage. I said, no, it's a prescription medicine. I will have nothing to do with it. And what I found is that it's helped me a lot. So it was a very worthwhile prescription medicine for me to consider. And though prescription medicines and surgery are definitely not my first port of call when I'm working as a vet and caring for animals, if I don't have them on the table, I'm actually not being holistic. Because holistic care means, for me, it means a couple of things, but one of the things that it means for me is considering all the options. Because in some cases, prescription medications are going to be the best thing possible for your animal. If you've got an animal with a raging infection, antibiotics are a damn fine idea. If you've got an animal like the little dog I worked on this week to do a dental under general anaesthetic, from who I had to extract 15 rotten, loose, painful, infected teeth, this is absolutely the best possible invention for that little dog that could have happened. Now, that's not to say that you're not going to use holistic supplements and holistic principles and other holistic treatments to support your animals through the need for more allopathic interventions like prescription medicines and surgery when they're truly necessary. And that is a great idea and a good thing to do. Now, I have a pretty strong bias towards holistic healthcare for myself. And I find that a lot of the people whose animals I care for also have a strong wish to care for themselves holistically and their animals holistically. And there can be a range of reasons for this. There can be, like myself, Western medicine was unable to help me with chronic health conditions, so I explored a whole lot of alternative complementary stuff and found things that helped me get a lot better. Or people might have had bad experiences with allopathic medicine with themselves or for their animals. So I'm going to go through my approach to holistic pet healthcare and what I think is the best way to go about this. I certainly encourage you to have a holistic or integrated vet on your pet's healthcare team. Even if there's not one close by, you can absolutely work over the phone or over the internet to have a holistic or integrated vet to run past what's going on with your animals and help make decisions and make suggestions for holistic and integrative treatments to support your pet through whatever's going on for them. So number one, I want to have a strong focus on preventative health care. With regular health checks, your animal should be at a minimum going to a veterinarian for a thorough physical exam once a year, preferably. Gold standard would be every 6 months. You should have a holistic life health care plan, which is going to look at diet first, disease protection, titer testing instead of over vaccinating, supplements that can help, and training, exercise, all those other things that you need to consider for your animals to make sure that they're going to have a happy, healthy life. And hello to everyone who's watching live and everyone who's on the replay. Please say hi in the chat and just check in with your name and where you're from. I'd love to hear where you're from. The second principle that I use in my approach to holistic pet healthcare is to consider the whole animal in all the decisions I make when it comes to their health and well-being. Whether you've got a healthy animal that we want to keep healthy or whether I'm working with a sick animal that we want to make well. I want to look beyond the physical to the mental, emotional, and the family unit, the context that the animal is living in. Now, disease is always more than just the symptoms we can see in the sick animal. It's an expression of deeper imbalances in the body, mind, system that need to be addressed. And hi Bev from the UK, Michelle from Indianapolis. Lovely to see you there, thank you so much. Tone from a flag which it's too small for me to see, but welcome. And if there's anyone else there on the replay as well, I'd love to hear where you're from. Please do check in. Lynn from Derbyshire, welcome. With 10 naturally healthy toy poodles, you must have a pretty lively house if you've got 10 toy poodles. My third principle is that I want to empower the human, who is the guardian of the animals that I'm working with, to understand what's going on every step of the way. I want to talk to them about what's happening in terms of options, choices, diagnostic test results, so that they can understand exactly what's going on and make the best possible informed decision for their animal without feeling pressured. Now, I have quite a few clients who've been to other vets, and other vets put a lot of pressure on people to do this or to do that, and it can be difficult. I also educate humans on an individual level and with online trainings and with videos like this, how to take great responsibility for their pets' well-being. Now, that can be by teaching issues like silent pain, which is a huge issue, often missed, anxiety and trauma, how to help animals with anxiety and trauma. And I primarily, and poor boundaries, overexcitement, crazy pets, I primarily do this by teaching people like you how to find and relieve silent pain, how to soothe anxiety, and how to heal trauma with healing bodywork with your own two hands, with the whole energy body balance method. So if you're interested in learning more about that, hit me up with a message. Contact me through thehealingvet.com. Love to help you help your animals. The fourth thing I do is invite and support the human to love and care for themselves as well as they love and care for their pets. Now, I'd love to hear from you in the chat. Do you care for yourself as beautifully as you care for your pets? Now, if the answer is no, that's actually a bad thing for your pets, because the better you care for yourself, the happier and healthier your pets are going to be. So I encourage you to start thinking about that, and if you're not treating yourself as well as your pets, get onto it. The fifth thing I do is I want to gather data. The first thing I'm going to do is take a really deep history, ask a lot of questions about what's going on with the animal, and then a thorough physical examination and diagnostic tests. Now, if you've got a sick animal, blood tests, x-rays, CT scans, ultrasounds, all these things can be very, very useful information gathering exercises. But I never do diagnostic tests unless I feel like there's a really damn good reason for them, because they're expensive, and it's important not to just waste money and time and effort. We want to do focused, careful interventions when it comes to diagnostics. But blood tests are a great idea, and if your animal's got a lump that's getting bigger, we need to find out if it's something nasty, which might involve fine needle biopsies or other biopsies, and then discuss the options and make an informed choice. The sixth thing I'm going to do once I get the information is generate differential diagnoses and try and come to a definitive diagnosis about what's going on. Now, if you've got an animal with multiple problems, this can take some time. After we find out what's going on, after we've worked out to the best of our ability what the problem is, the disease process that we want to help the animal with, then we want to formulate a holistic treatment plan or an integrative treatment plan that's going to best serve this animal's needs to get well or stay healthy. And that's where I integrate the most natural, safest, holistic diet, supplements, medicines, interventions like bodywork, acupressure, acupuncture, that I possibly can, herbal medicines, things like that. At the same time, I'm going to be very pragmatic, and I will strongly recommend prescription medicines if I've got an animal with a raging infection and a fever that needs to have some support. And I will absolutely recommend surgery, especially if I've got an animal with a rotten mouth that needs a dental. You cannot do effective dental work on an animal without a general anaesthetic. You just simply can't. I had a little dog in this week who I had to extract 15 rotten, stinky, horrible, infected teeth from, and this little dog is going to be so much happier after that surgery. You should be having a dental with your animals at least once a year under general anaesthetic with x-rays, full clean, scale and polish, and seeing what's going on. And then the 9th thing that we're going to do is monitor the response to treatment and adjust the holistic treatment plan as required, which involves revisits, talking about how's responding, perhaps further testing if need be, so on and so forth. And once the animal is covered, if they're ill or if they're healthy, then we're going to move to that ongoing maintenance of regular checkups, a life holistic health plan to keep the animal healthy and vital for a long, long life. Now, this is quite a journey, right? It's not veterinary science, and being a veterinarian and working with animals on this level is not a simple or easy process a lot of the time. It takes time and effort and expertise to be able to really help animals with beautiful, holistic, integrative medical care. Now, like I said, if you don't have a local holistic or integrated vet, get one on your team and work remotely. You can run by the suggestions, the diagnostic results and all those things from your regular vet and run them by them and have a different point of view about, which will help you in your decision making process and take pressure off you. Now, in an emergency situation, this may not be possible, but nearly always in a true emergency, you're going to need to be getting allopathic, high care, intensive care interventions happening straight away. You know, if you've got a dog with pyometra or bloat, man, we're going to put them on the surgery table, hopefully within half an hour of them coming into clinic, and then you're going to focus on more holistic care in terms of recovery, rehab, supporting their recovery from the surgery. Then we can do a lot of stuff with holistic care. Bev says, my dog has a lump on his chest area. Vet says it's fatty lumps without taking a sample. Bev, I've got to tell you, there's no way you can be sure what a lump is without taking at least a fine needle biopsy. It's just impossible. You're guessing. And I encourage you to go back to your vet and insist on at least a fine needle biopsy and a smear to be sent off to the lab so you can find out what you're working with. Now, I've talked about dental health, and I've talked about if you really want to be holistic, you have to consider all the treatment options, including prescription medications and surgery when needed. And when needed, they're going to be really important. And you need to care for yourself. Now, if you want to have me help your pets, I help people from all over the world. I do Zoom consults. I teach people the whole energy body balance work. I have free webinars about silent pain, a free workshop where you can start learning some hands-on skills to make your animal's life a whole lot better. Hit me up with a message if you'd like to work with me. I'd love to help you help your pets have the best life possible, naturally and holistically. Okay, that's it for this week. Thank you so much. We'll see you back again next week. Bye for now.